everyone, I'm Corine. I'm a kinesiologist from Copeman Healthcare in Vancouver, and today I wanted to run through a little spine series for you. For anyone who has reoccurring back pain or currently having some issues with their back where they're noticing some weakness or some trouble with lifting, sometimes even also when you've been through chronic pain, so when it's a long-term issue. Hello Telly, this is Telly, my dog. Go and rest there. If you've been long-term chronic pain with back pain, what we need to do now is retrain the body to not be so initiated with pain in that area. So we need to get our brain communicating with the nerves in that area and telling them that it's okay to move again and to not be so sensitive to pain. So a lot of the times the nerves in that area are extra excitable, so any sort of movement in that area will kind of cause a pain response, and we need to kind of retrain those nerves that there actually is no damage to that area anymore, and we want to get proper healthy movement to that area again. So these are sort of going to be exercises that are a really good first step in retraining the pain response and retraining the brain to communicate with those muscles in a healthy way again. So I'll run you through a few of the exercises. It's nice to have a towel for one of them. There's a few different systems in the body that we need to get working again. Some of it has to do with your pelvic floor and your transverse abdominals, and those are deeper abdominals that are underneath your six-pack abs, and those attach to your spine and help with spine stability. Also your diaphragm, we're going to get some breathing going with each exercise, get the diaphragm moving nicely. And then also you have some smaller multifidus muscle groups that actually attach and elongate the spine. And those are going to be really good for retraining so that when you go back to walking, running, or uneven surfaces or weight bearing, you've got that really nice stability for your spine, and hopefully that will help to reduce any compression or future pain. And it's also important with back pain or any of these exercises, if you have any increases in pain, especially to more than a 7 out of 10, that you stop the exercises and speak to one of your health professionals for help. Also, if you have any undiagnosed back pain or new reoccurring back pain, it's important to talk to a health professional to get advice to see if these are safe exercises to start doing. If you need any help, we have kinesiologists too at Copeman Healthcare that are happy to look into a proper individualized exercise program to fit your needs. So one of the really important aspects to spine rehabilitation is actually learning proper breathing technique using your diaphragm. So your diaphragm is quite a strong muscle, and it's important for actually filling air into your lungs. And a lot of the time as we go through chronic pain or just throughout life and we're not conscious of our breathing, we tend to be quite shallow breathers, and we don't actually let air to fully come into our lungs and expand our lungs properly. And then it makes it a bit more difficult to exhale as well. So if we can get our diaphragm moving all the way down and all the way back up again freely, then that's going to give us a lot more opportunity to get oxygen into our lungs. And better oxygen into our lungs is so good for our health for many aspects, so we need it for even energy production. So what I'd like to take a few minutes doing is just getting you into some breathing techniques, and again, this is really good to practice daily. So when we inhale through the nose, we want it to be so much air coming in that our belly is going to fill with air. Our ribs are going to expand outwards, and you're even going to fill air into your back so it expands. So we still want the chest moving up, and we still want the shoulder blades nice and tall and firm, but we don't want too much of the hiking of the shoulder blades, especially right away. You first want the air to fill the belly, and then you want the chest to fill up. So it's going to, if you put one hand on your chest and one hand on your belly, you want to inhale so that it fills the belly out first. And then you want to think about your ribs expanding, and then the back of your chest expanding, and then the chest coming upwards. So it'll look a bit like this. And then as you exhale, I want all the air coming out to the point where you can't let any more air out. So as the air comes out, the belly comes inwards. And when you think you're at the end of your breath, try and breathe more out. And again, that gives you the opportunity to fill up more. One more time. And when you think you're at the top, fill more into your back. Good job. So that's definitely going to take a little bit of getting used to. It's going to be very difficult to recruit all of that right away, but I promise the more you practice, the easier it'll get. And the more air you bring in, the more air you bring out. And the more air you bring out, the more you can bring in. So keep at it and you'll get better at it, and I swear it'll change your life. And we want this to be the focus of our practice today as well. Every time we're moving, we want to have those long inhales and those long exhales. Because as you see, when you inhale, it opens up the body, and then as you exhale, your abdominals will just naturally activate the way they should. We don't need to tense our abdominals too much or pull up too much to make movement happen. So we want to use the breath to lead our movements, and hopefully that'll also calm our nervous system as well. So if you're ready, let's get into it. So we're going to start on our backs and initiate some pelvic floor activation and transverse abdominals. So you can have a bit of a pillow for your head if you need it. You want to be able to feel 2 fingers underneath your spine and have your spine touching your fingers. You don't want it so much so that your spine is totally flat pressed into the mat, but you also don't want to be arching off the mat. So you want that nice and neutral spine position. You should be able to just fit 2 fingers underneath your back and feel your back touching your fingers, and that will kind of help you understand neutral spine and make sure that your pelvis and your hip bones are level. So from this position here, you're going to, as we bring one leg out, slide it along the ground and slide the foot back in. When you get back to the starting position, you can relax everything. So you want to have your hands on your hip bones just to make sure that while you're practicing these engagements, that the hips are staying level and they're not moving or tilting or different on each side. You really want to keep practicing that pelvic stability as you're doing this exercise. And again, we want to breathe the whole way through. The leg come out, and then draw the leg back in. So you're just going to go for about 10 leg slides total, and then you can come back to the middle for a rest. Good, and then when you get back to the middle, we're going to practice another exercise where you're holding that engagement, so drawing the navel in. You're going to let one leg fall out to the side, and then use your exhale to bring it back in. So inhale out, and then exhale back in. So again, trying to maintain that pelvic stability and using those inner thigh muscles and abdominals to draw the leg back in. So only go as far out as you can without losing that pelvic floor activation, and then nice and easy bringing it back in. So we're going to go for 10 total. Last one. Good job. Then coming back to center for a rest. Next you're going to engage that pelvic floor, and then we're going to march the knee up and then bring it back down. Have a rest and then engage those muscles again and marching the leg back up and coming back down. So again, we're going to go for 10 total. Just trying to maintain that pelvic stability and core activation. So if you're finding while you're doing this one, if you're unable to maintain that pelvic floor activation the whole time the leg is moving, that might mean this is too complex for you at the moment. So you can just go back to your fallouts or your leg slides until that you've mastered that exercise. do a few more here. Good. Coming down for rest. So if you wanted to make that more challenging, you could bring the legs into tabletop. And that right there is a very challenging exercise to maintain your pelvic floor activation. And that you still want to be able to fit the 2 fingers just under your spine. And then maintaining this position, you can exhale to tap one heel down and bring it back up. And then exhale, tap the other heel down and bring it up. So you'd go for 10 total. And we got 5 more. 5, 4, 3. You just want to make sure the knees are staying over top of the hips. What will happen when you're getting tired is you'll either move the knees towards you or out further. So always keeping the knees on top of the hips as you tap the heel down and then slowly bringing it back. And then when you're done, you can bring both legs down for a rest. Excellent job. So from there you can roll to the side. And this is when we're going to use our towel and lay on our towel with our hips. So if you have the towel, you can either roll it halfway up or all the way up, depending on what is most comfortable for your body. And what you want to be able to do is lay your hips on that towel. So this will kind of help with your spine, keeping it comfortable so you're not in too much extension. So with the hip bones both touching the towel, you can place your forehead on your hands for now. And then from here we're going to practice motor control pattern training with our multifidus muscles and our glute muscles. So with this you're going to squeeze one butt cheek and lift your foot off the ground very slightly. Only go as far as you can with maintaining both hip bones touching the towel. So you don't want to do a very high lift, and then you come down, rest fully. Then you're going to squeeze the other butt cheek to lift the leg slightly off, keeping both hip bones on the ground. This is actually also great to practice that pelvic floor engagement, so bringing the belly button up towards your spine, holding your P, then squeezing your butt cheek to lift the leg, hold for 5 seconds, and then relax. So keep alternating. We'll go for 10 total. And then to progress this exercise, we can also incorporate our arms. So you always want to try and keep length in your spine as you're doing this. And always keep remembering to keep your belly button up, away from the ground, towards your spine. Make sure you relax when you get back to the middle before you squeeze the next butt cheek. And always keep the hip bones touching the mat. So to create length in your spine, you can sort of envision the base of your skull going towards the wall in front of you. So to incorporate your hands and arms into this exercise, you'd have your arms out in front of you, and it'll sort of be like a Superman position. So keep the base of the skull going towards the wall in front of you to keep length in your spine. You're still going to keep the pelvic floor active, and then you're going to squeeze your butt cheek and lift the opposite arm at the same time. Hold that for 5 seconds, and then switch and do the other side. So you're just alternating this way. Always trying to keep the lats active by bringing the shoulders down away from your ears. Just aiming for 10 total. And try and keep breathing throughout the exercise. So you can exhale when you come up, and then inhale on the way down, whichever feels most comfortable for your body. We'll go for 5 more. 5, 4, 3, 2, and 1. Excellent job. So you can roll to the side to take the towel out, and then you can come back up onto all fours. Maybe sit back towards your heels to get a nice low back stretch. And hold that for 5 seconds. And then we can come to all fours. So on all fours, you might need some padding underneath your knees if you're on a hard surface. Just make sure the wrists are underneath the shoulders and the knees are underneath the hips. And then from here, you can practice the leg coming out from underneath us. So keep pushing away from the mat so that you're not collapsing in the upper body, and keep your gaze towards your hands in front of you. So you're going to let your pelvic floor come up, keep that core active, and you're going to let one knee fall out from underneath you and use that glute to extend the leg out. Try and keep both hip bones pointed down towards the mat. Then you can slowly bring that back. Then next we're going to try the other leg. So the weight transfers to the other leg. You let that leg come out from underneath you. The hip bones stay facing down. The belly button stays up. And you keep pushing away from the mat. And we're just going to keep alternating. So keep that belly button drawn up towards the ceiling. And just extending the leg behind you with the hip bones pointing down. So you don't want to be tilting too much to the side for this exercise. And then if we want to progress this exercise to make it more challenging, the opposite arm would come out and we'd balance there with the hip bones down, belly button up, pushing away with the standing arm, and then bring it back to center. Straightening out, and back to center. We'll go for 5 more. 5, and back. 4, and back. 3. Okay, so next laying on your side, elbow underneath your shoulder, shoulder away from your ear. You're just going to have your body nice and level. So the knee, hip, and shoulder all in one line. The feet are back behind you. You're going to have your hand interlaced behind your head. Elbow can be in the peripheral vision, and you're going to come off the hip, so drive the hip up onto your knee and elbow, so keep pushing away from the mat, and we're going to be lifting our hip nice and high and rotating upwards, and then you're going to just come down just so that the hip is about to tap the ground, and then you're going to rise back up. So we're just allowing the elbow to come up and over as the hip goes high, and then we're coming back down. So you can inhale on the way up, nice big air into the bottom of your lungs, and then exhale everything out on the way down. So hips driving up on the way up, and then the bottom of the stomach sinks down to come down. Keep your shoulder away from your ear. Keep a nice long spine. So it's like the base of your skull is always going that way. And then sinking down nicely. We'll do 1 more. And then you can come down for a rest. And rest. Excellent job. So next what we're going to do is we're going to add a bit of rotation onto that. So when you come up tall on your hip, so get that alignment again. What we're going to do is we're going to rotate forward, exhale all the air out, inhale back, straight up, and then the hip comes down. So coming up first, rotating as you exhale, and then back up to the top, and then tapping down as you drive up again. And we'll add 3 more. And last one. Good, coming down for rest. Next we'll go to the other side. So again, getting the alignment with your elbow underneath your shoulder, knees, hips, shoulders in one line, feet are back. You're going to come up off your hip onto your knee and your elbow. Keep pushing away from the mat. Interlace the hand behind your head Try not to pull the head at all with your hand, just have the head resting nicely and then keeping that nice long spine so that the base of your skull is going towards that side wall. So from here you're tapping down, then driving up with the hip and down. Driving up and then exhale down. Driving up and then coming down. Driving up, coming down, and we'll do 2 more. Have a rest at the bottom, and then from there we're going to add in our rotation. So you come up onto your elbow and your knee as high as you can, and then we're rotating forward. Inhale back up, and then tapping down. Inhale to the top. Exhale as you rotate. Coming back up with the inhale, and then exhale, tap down. Inhale to come up. Exhale as you rotate. Inhale back up, and then tapping down. We'll do 3 more. Up, rotate, back to the top, and then tapping down. So keep pushing away from the mat. Get the hips nice and high. Rotate and come back. Try to keep your shoulders away from your ears as you get tired. And then last one. Up, around, and then coming back down for your rest. Excellent job. Next, we're going to work into back extension. So we're laying on your stomach. So in this position, we're going to keep our feet on the ground. You can have your feet slightly apart or together, and we're going to try to be working the upper body. And it's really important that you keep your belly drawn up and that you envision the base of your skull going towards that wall, because we want to create length in our spine. So we want to be as tall as we can that way for the entire exercise. So it's not how high can you get, it's how long can you maintain. So every time you inhale, you're going to try and get longer, and then as you exhale, you're going to try and maintain that length through the exhale before you inhale again. So from here, what we're going to do, we're going to have our elbows out by our sides, and we're going to tilt. So keep your gaze looking down at the mat. Slight chin tuck, base of the skull going that way. You're going to have your elbows out by your side, and then we're going to draw the hand higher than the elbow. And you want to maintain this angle where the hand is slightly higher than the elbow for the whole first part of the movement. So next, you're going to hover the elbow off the mat, but keep the hand higher than the elbow. And then we're going to reach out in front of us, keeping that height in your mid-back. So you want to try and lift from the heart up as we swing the arms back. Try and go a bit higher so that almost your stomach is coming off the mat as well. So keeping that height there, we're going to rest everything and come back down to the start. So make sure you relax everything, and then you're going to raise the hand off the ground first, and then the elbow. Draw the shoulder blades together, space from your shoulders away from your ears. And then from here, you're going to reach forward, keep that height and length in your spine as you inhale, and then you're going to exhale, coming a bit higher up. Keep the gaze down as you bring the arms back. And then again, keeping that height for a few seconds. You're going to try and rest everything back down. Take a little breath here, and then we're going to try one more time. So you're going to bring your hands higher than the elbows, then the elbows hover off. Nice high chest. Keep that length in your spine, belly button's up. You're going to reach forward, keep that height and that length, and then you're going to exhale, come up a bit higher. And then you can bend the elbows back down and then come back down for a rest. Excellent job. So sit back into your child's pose position just for a nice back stretch. And just breathing here Next, when we lay on our stomachs, we're going to have our forehead resting on our hands that are stacked on top of each other. So keeping the feet down, you're going to raise the heart off the ground so that you're just hovering off the ground. It doesn't have to be extremely high, but again, we want to keep that length in the spine. So you still want to be acting like you're shooting the base of the skull out that way, keeping that length as you breathe in. And then we're going to exhale, pivot to one side. And then we're going to inhale, get that length in the spine back. And then we're going to exhale over to the other side. And again, inhale. And then exhale to the other side, keeping that length in your spine, belly button's drawn up. And then we're going to inhale, hover in the middle, and then we're going to go to the other side. Exhale. So inhale, keep that length, and then exhale to the other side. And we got one more time, inhale, and then we're going to exhale to the other side. And then you can come back to the middle, and then you can relax everything down. Excellent job. Lastly, we're going to go into swimmers. So you're going to have your arms reach out in front of you. If this is too intense for your back, you can keep your arms anywhere by your side and just use the legs. But the aim to start is we're going to be having our arm out in front of us. And you're going to keep both hip bones on the ground for this. And we're going to start by having right arm, left leg come up. Use that butt squeeze to raise the leg, but try and keep both hip bones touching the ground or as close to the ground as you can. And then you're going to alternate and do the left arm, right leg coming up. Keep your gaze down on the mat, and you can have a little bit of extension with your heart raised off the mat. And we're just going to keep alternating legs. So maybe do 5 seconds on one side, 5 seconds on the other side, just to get used to it. Make sure you're relaxing everything in between before you activate the glute to raise the leg on the other side. And then we're going to start going a bit faster with this movement. So then we can start going a bit faster. And again, if you're finding this too tough on the back, you can just be doing the legs. And then you can go into swimming. And again, if that's too much for you, you can slow it back down. And we're just going to do 5 more. So 5, 4, 3, 2, and 1. Excellent job. You can sit back towards your heels. Again, try and maintain length in this position. So have your knees wide. You're sitting down towards your heels with your butt, and then your hands can be active into the mat. And you can even activate the hands into the mat, and then try and activate them down towards your knees or your armpits. And that'll be a nice lat stretch for you. And then you can go over to one side, so stacking the hands. And just inhale, and then exhale, sink back towards the heels a bit further. Great, coming back to center, and then we're going to go to the other side. Stacking the hands, inhale, and then exhale. And inhale, and then exhale. Excellent job. So you can walk back up to your seated position. Next, we're going to lay on our backs and get some stretches in. So you're going to have one leg straight. We'll start with our left leg straight and bring our right knee into the chest. So as you inhale, exhale, and try and bring it in a bit closer. So you can go to the outside of the rib cage if you want. And then you keep this other leg that's on the ground straight with the toe flexed towards you. And we're just going to hold this here for a couple breaths. If you want to activate your knee into your hand to get a bit more of a stretch, you can hold that for 5 to 10 seconds. Just breathing here. Excellent. And then from there, we're going to cross our leg over our body. You can keep the opposite arm out straight beside you. and you can look towards that opposite arm as you bring this knee over. And again, we're just going to inhale and then exhale. Inhale and then exhale. And then for the last part of the stretch, you can take that foot and wrap it around your straight leg and get a little bit more of a stretch in there. Excellent. And then coming back to the center, you can do a quick little bridge to realign the hips, and then you can straighten out the other leg. Bring the other knee into your chest, kind of to the outside of the rib cage, and then inhale, exhale, bring it in a bit closer. And then again, you can activate the knee into the hand, hold for 10 seconds. And then we can bring that knee across our body over to the floor, and then the other arm can be out straight. You can turn your gaze towards that arm and try and bring the hand on top of the knee to get it a bit closer to the ground. Inhale, and then exhale, trying to stretch a little more. Inhale, and then exhale, starting to stretch a little more. So you might feel that in your chest. It might be a bit difficult for you to get your shoulder on the ground, and that's okay. That's a good area to stretch. And then for the last little part, you can have your foot wrap around that straight leg if you can get it there. Excellent. And then you can roll back to center. And we can bring both knees into our chest, just to the outside of the rib cage. And if you want, you can kind of roll into circles just to massage that area. Inhale, and then exhale, bring it a bit closer. And then if you want, you can go inside your legs, but then grab onto the outside of your foot. And then you can go into this kind of happy baby position where you're kind of pulling the feet down so that the knees come further towards your stomach or outside of your ribs. And trying to get the spine flat on the ground, belly button's in. And just a couple breaths here. Excellent job. So you can kind of roll up to a seated position. And then from here, we can cross our legs. So instead of crossing them really close to us, just to kind of have them out further and try and make like a 90-degree angle, you can either stack them on top of each other, just have one in front of the other slightly. And then from here, keep the feet flexed. And you're just going to slowly walk out forward. And you'll feel this in your hips, in the glute area where they attach to your hips. And then just keep a nice long spine looking down at the mat. And then just go into whatever range you feel that stretch. If you're finding you don't feel it yet, you can even walk all the way further to your elbows, or even just fold your head towards your shins. And just stay there for a good 30 seconds. And when you're ready, you can walk out and we'll switch legs. So now the other leg goes in front. Sitting up nice and tall, keep the chest forward towards the wall and walk yourself out till you feel that stretch. Wherever that range is for you, you can hold it there. Relax the head and neck. In just 30 seconds or 3 breaths in and out. It's a great way to relax the nervous system is by breathing. Excellent, and then you can walk yourself back up. And if you'd like to get a bit further into the glutes, if they're tight, we can also lay on our back and cross one leg over. And you can either push down on the knee from there, or you can bring that bottom leg up and that's a nice stretch for the glute. You can hold on to the back of the leg if you want a little more, and if you want more than that, you can hold on to the shin. So just pick whatever range to feel a slight stretch. It doesn't have to be anything really intense. And then you're, again, 3 breaths here, or 30 seconds. Good, and then you can switch sides however you need to. So either down here, flex that foot, or you can bring the leg up, holding on to the back of the leg. And again, a few breaths here. And then you can cross the knee over to the other knee. So bringing them together and then flexing the foot. You can hold on to the ankles and just kind of press slightly down towards the mat with your hands. You should feel that also in the hips and the side of the legs. And we're just going to hold that there for 3 breaths. Good, and then we'll go to the other side. Good job. So you can take the legs bent in front of you, and we can just windscreen wiper the legs side to side. Just kind of massage the low back and get the hips moving again. And then you can bring your legs out straight, reach your arms overhead, walk your heels away from you and reach for the wall in front of you. Big stretch, inhale, and then you can bring the knees back up, and then you can either roll to the side or roll yourself back up into seated position. And you're done for today. Thank you.